Okay, let's get into this. Think about that little jump you might get when you see a needle. Or maybe uh, that slight discomfort thinking about a cut.
Yeah, that little wince.
Right. But imagine that feeling just amplified massively,
Mm.
so much that it actually starts running your life, affecting your health choices.
Mm-hmm.
For some people, it's not just a minor worry, it's a really powerful disruptive thing.
And that's really where we're focusing this deep dive today. Traumatophobia, sometimes called injury phobia, or BII phobia, blood injury injection.
BII, okay.
Yeah. And we're going to unpack what that really means based on, compiled research, understand what makes it tick, what makes it different, and how it's handled.
So the goal here is really to get some clarity on something that, like you said, can be way more serious than just being a bit squeamish.
Exactly. We want to shed some light on it.
And the name itself, traumatophobia, it kind of points us in the right direction, doesn't it? It comes from Greek.
It does. You've got trauma, which means wound or hurt, and then phobos, which, well, that one's pretty well known. It means fear.
Fear. So fear of being wounded or hurt. It's right there in the name.
Precisely. And if we look at the more formal definitions, say from the DSM-IV,
Right, the diagnostic manual.
yeah, as it's talked about in the Oxford textbook of psychopathology, it classifies injury phobia under that specific phobia category, the blood injection injury type.
Okay.
And it's defined by what they call an abnormal pathological fear of actually getting an injury.
An abnormal fear. So it's not just about seeing blood or, not liking needles. It's the fear of the injury itself happening.
That's the core of it, yes.
How do we tell the difference then between someone who just, looks away during a blood test and someone with actual traumatophobia? Is it just how scared they get?
That's a really key question. Intensity is part of it, for sure. But it's more than just feeling uncomfortable. Traumatophobia involves this irrational or excessive fear. It really gets in the way of life.
Irrational or excessive?
That's not bad.
Okay.
Yeah, it's persistent, it's overwhelming, and it leads to this really strong urge to avoid anything connected to potential injury, blood, or needles.
Anything.
Pretty much. And that avoidance, well, that's where it can get really serious because it might mean avoiding necessary medical treatment.
Ah, right. That's huge, avoiding the doctor or dentist.
Exactly. And that's not just, skipping your annual flu shot, which isn't great either, but
No, it could be much bigger things.
much bigger. People might delay critical screenings, maybe for cancer, maybe diabetes checks, things that, if caught early, are treatable, but if delayed.
The outcomes could be much worse.
Wow. Okay. So understanding this isn't just academic, it has real health implications.
Absolutely. It ripples out. Now, something interesting came up in the research, specifically a study mentioned in psychological medicine. It was looking at prevalence, how common it is, an epidemiological study.
Okay. What did that find? Anything surprising?
Well, it suggested that traumatophobia seems to be more frequently diagnosed in females.
Really? More common in women. That's what this particular study indicated, yeah. Of course, phobias can affect anyone, but it points to maybe a pattern that needs more looking into for research and treatment.
Interesting. Okay. Now, one thing that really stood out to me from the research was the sheer intensity of the reactions people can have. It's definitely not just, oh, I don't like that.
No, not at all. When someone with this phobia is actually exposed to blood, an injury, sometimes even just the idea of an injection, the reactions can be, well, extreme, physically and psychologically.
Okay, like what kind of physical reactions are we talking about?
Well, the research describes things like breathlessness, sweating, sometimes profusely, dry mouth, feeling really sick, shaking.
Shaking, okay.
Yeah, heart palpitations, that feeling of your heart pounding or racing. Some people find they just can't speak or their thoughts get all jumbled.
Like their brain just freezes up.
Kind of, yeah. It's like the body's alarm system is just going haywire, even if the situation isn't objectively dangerous.
Wow, that sounds completely debilitating. And you mentioned psychological reactions, too.
Yes, absolutely. People might report intense fears, like a fear of dying or losing control or even going mad.
Seriously, fear of dying.
It can feel
I
that
think.
intense, yes. Some also describe feeling detached, like they're not really in reality. And for many, these triggers can escalate into a full-blown anxiety attack.
Which is just terrifying in itself.
Incredibly distressing, yes.
Now, something else I found interesting, how this is separated from, say, dental phobia.
Mm-hmm.
I sort of assumed they'd be linked. Fear of dentists often involves needles or potential pain.
That's a very common thought. But
Uh,
actually, a study in the Journal of Anxiety Disorders, I think it was from 2014, specifically makes the point that they're generally seen as distinct conditions.
huh, distinct. Why is that?
Well, the study suggested one factor might be something called anxiety sensitivity.
Anxiety sensitivity, what does that mean?
It's essentially being afraid of the symptoms of anxiety itself. So someone with high anxiety sensitivity might fear their own racing heart or feeling dizzy because they interpret those feelings as dangerous.
I see. So how does that make dental phobia different?
Well, with dental phobia, the fear might be more focused on the specific procedures, the sounds like the drill, the feeling of loss of control in the chair, or maybe anticipating pain from the dental work itself.
Right, the whole environment.
Exactly. Whereas with traumatophobia, the primary trigger is more specifically the sight or thought of blood, injury, or injection, regardless of the setting. The BII cues are central.
Okay, that distinction makes sense now. Even if a dentist uses a needle, the core fear might be different for someone with dental phobia versus traumatophobia.
Precisely. The focus of the anxiety seems to differ.
So if someone gets diagnosed with traumatophobia, what help is out there? What do the treatments look like?
The main routes mentioned in the research are behavioral and cognitive therapies. Behavioral therapy seems to be the most common, actually.
Behavioral therapy, like changing how you react.
Exactly. And a key technique within that is exposure therapy.
Exposure therapy. Okay, that sounds intense, given the fear we're talking about.
Yeah.
How does that work without just, terrifying someone?
It's done very carefully. The whole idea is gradual and repeated exposure. It happens in a controlled, safe space.
Gradually.
Yes, you start with things that cause maybe only a little anxiety and slowly, step by step, work up to the things that are more challenging. The goal is to help the person learn over time that these things aren't actually catastrophic.
So they're reaction lessons.
Exactly. The phobic reaction decreases or might even stop altogether with enough practice and time. It's about retraining the brain's fear response.
Retraining the brain. Okay, that sounds logical, even if it's challenging. Was anything else mentioned?
Yes, hypnotherapy also comes up as a potential treatment option.
Hypnotherapy. How does that fit in?
Well, the sources didn't go into huge detail on the specifics for traumatophobia, but generally, hypnosis can be used to help people access and kind of adjust the thoughts and feelings linked to their fear, maybe making them more receptive to other therapeutic work like exposure.
Interesting. Okay, so there are definite paths for treatment.
There are, yes, which is really important.
So pulling this all together then,
Yeah,
it seems clear that traumatophobia is, well, it's a lot more than just not liking needles or feeling a bit queasy at the sight of blood.
absolutely. It's a recognized specific phobia, focusing on that intense, irrational fear of injury, blood, injections. The key things are those extreme reactions, both physical and mental.
Right, the breathlessness, the fear of dying.
Exactly. And critically, that drive to avoid situations that might trigger the fear, which, as we discussed, can seriously impact health if it means avoiding doctors or necessary procedures.
And remembering it's distinct from something like dental phobia, potentially because of things like anxiety sensitivity being involved differently.
Correct. And the good news is that treatments like behavioral therapies, especially exposure therapy and potentially hypnotherapy, can be really effective.
Okay, so for you listening, hopefully this deep dive has maybe put a name to something or just offered a clearer picture of what traumatophobia involves. It's not just squeamishness. It's a condition with real diagnostic criteria and potentially significant effects.
Understanding that severity and specificity is so important, whether it's for yourself or someone you know, it's the first step towards getting the right kind of help.
Which leads to maybe a final thought to leave you with.
Mm-hmm.
Given how much a phobia like this can interfere with basic health care, how might a broader understanding, general public, of these kinds of specific anxiety disorders actually help?
That's a great question. Perhaps if we all better appreciated the sheer intensity and the distinct nature of these fears,
Yeah.
maybe that understanding could foster more empathy, more patience, and ultimately lead to creating better, more accessible ways for people to find and engage with the treatments that can genuinely help them live healthier, less fearful lives.